I wouldn't say you need a reading list for medicine, but I think what's really important is that you get a good variety of books, all by different authors, possibly English, American, whatever, but that you also get patient journeys and you try to understand the patient and the condition from their point of view. When you are reading a book, make sure to write down some of the salient points and really get some lessons out of it. Just remember that med schools aren't expecting you to know everything about medicine, aren't expecting you to understand all the different conditions, but they're really trying to make sure that you understand patients and that you're empathetic and sympathetic towards them. Here are my top UCAT tips. Number 1, do your driving theory test in the place beforehand. It just takes an unknown out from test day. You use lots of different resources online. Medify, Medic Portal, there's lots of free places as well you can use. Lots of hard work. 3 weeks or so before test day, really make sure you rattle down, get through those online banks and do it under pressure. It will really help on test day. Make sure you can use the on-screen calculator with the keyboard really quickly. It just saves so much time in the quantitative reasoning part. Use the official UCAT tests online, but please do be warned, from personal experience, these are a lot harder than the real thing, so don't feel too disheartened from them. Read the GMC's Good Medical Practice, was really useful for the SJT and good for interviews. And last of all, just make sure to stay calm on test day, wear something comfortable. I went in shorts and t-shirt and just do your best. So for medicine, obviously it's very competitive, so you do need to try and get as best grades as you can. For A-levels, you normally need 3 A's predicted, and this is normally used as a blanket policy for accepting candidates for interviews. And then when it comes to results day, they might be slightly more lenient, or they might ask you to get A-star AA, depending on where the place is and how competitive it is. Then for GCSE, depending on where the med school is and how they use GCSEs, some places score your GCSEs, or some places use it that you have to have a minimum number of GCSE grades to get to interview, but normally it's all part of the process. Some places use UCAT more, some places use GCSE more, some places use personal statement more. My advice to you is to apply where your strengths are. If you have good GCSEs, apply to a place that uses GCSEs a lot. If you have good UCAT, apply there. If you're a well-rounded person, apply to somewhere that has everything. Now, I don't study dentistry myself, but from a quick Google search, you need to get 3 A's or AAB in either or biology and chemistry. At GCSEs, to get me into medicine, I did the triple sciences, maths, English, geography, design and technology, French and computer science. What GCSEs shall I take to study medicine? It doesn't matter what GCSEs you do to study medicine in the future, but it is important that you do well in. So picking them tactfully is definitely a good thing to do. Doing the triple sciences is a very good start, as it gives you a good basis of the sciences, and it's always useful for when you're going to do A-levels in those respective subjects. Then just pick subjects you're good at, that you enjoy, and that you can put the hard work in, and you can show your universities in the future that you have the ability to achieve and get good GCSEs.